Welcome back to San Antonio Living. Well, did you overdo it this weekend and you can feel some of those aches and pains in your body? Well, we're going to show you how you can actually prevent that. And Dr. Brad Tolin, I should say, is here to talk about our cartilage of all things. And we're going to find out why we need to worry about it, because if you injure it or don't take care of it, it can really cause you a lot of pain, right?
Cartilage is really the shock absorber in the joint. And once it's damaged, the end stage of damage of a joint is arthritis. And so over 20 million people suffer from arthritis. And what we're trying to do is actually find ways to prevent arthritis.
So this is something that 20-year-olds need to think about, 30-year-olds, 40s, 50s, on up.
All the way up. I mean, typically most injuries in younger people can damage the cartilage. In older people, those injuries may not manifest itself for 20 or 30 years after the initial injury. And so that's actually what turns into arthritis.
Let's go ahead and take a look at where you find cartilage, and is it in every joint?
The cartilage, we're talking about articular cartilage, and there's two different types of cartilage in the knee. One is the meniscus cartilage. When people say, I tore my cartilage in their knee, a lot of times they're referring to the meniscus. The articular cartilage is what we're talking about here, and that's actually this blue area in this model. And we've actually created a little defect here to show you sometimes what a cartilage injury would look like.
So if that should happen, you'll feel it. You'll feel a lot of pain.
You'll feel it. And most people can have very similar symptoms as if they tore their meniscus. Mechanical symptoms, locking, catching, swelling, pain. And usually if that doesn't resolve over that first week or so, that's really when you should see your orthopedic surgeon.
Okay, before that, what can we do to prevent injuries? Is there anything we can take?
We've been recommending more and more frequently over the last few years glucosamine complexes, and these things tend to be very helpful. At first, after an initial injury, we use anti-inflammatories such as Motrin, Advil, which seem to be effective. The glucosamine tends to take longer to be effective, but it stays in your system longer with less side effects than some of the other medications.
Say you do injure yourself, there's some exciting treatments that are out there right now.
Absolutely. And what we do from a surgical standpoint in people that don't get better, and again, the majority of these cartilage injuries do get better just with simple things. In the individuals that continue to have problems with these type of defects, the treatment ranges from surgical involving an arthroscopy of the knee, where we go in and actually just clean up the damage, all the way to cartilage transplant type procedures, where we're actually taking little plugs of cartilage, such as a hair transplant, and moving them to fill the defect. And then the new and exciting area is actually the Carticell procedure, which you're actually taking your own cells, growing them in a lab, and then coming back and reimplanting them in your knee.
And how long does it take to grow those cells?
They're grown usually over about 4 to 5 weeks. And then within 6 weeks, we actually go back and put those cells back in the knee.
And once they're in, do you feel better instantly?
No, it's a very slow process. And that's just like when you injure the cartilage, it's a slow process sometimes to deteriorate. The process of healing after that type of procedure is also very slow.
But still, there is hope there. It just takes a lot of time. But the main thing is to make sure that you take care of your cartilage to begin with, right?
Absolutely.
And take the glucosamine.
Glucosamine, high impact activities you should avoid. I would recommend, if you're an active exerciser, use low impact activities, swimming, biking, elliptical trainers. Running is, if you have a bad knee, running is about the worst thing you could do for
What about tennis? I'm a big tennis player now.
Tennis is okay.
Okay. All right. Well, you know, as you age, you just have to modify, I guess, what you do out there or pay the consequences later on. Well, thank you so much for coming by and letting us know about why we should take note of our cartilage. And if you have any questions for Dr. Tolin, you can give him a call at this number, 489-7240. It's a Cartilage Repair Center of Texas. You can also learn more by going to cartilagetexas.com. And we'll be right back.